Mute. Can everyone hear me? Give a thumbs up. Yes? Okay.
Okay.
All right, so this is how we're going to do it. We'll do the opening remarks. Everybody should have permission to record. If you do not have permission to record, let me know right now. Is everybody good?
Well, I don't personally. I think we're recording at the station, but I'm not 100% on that.
I'm allowing you now, Wendy. And if anyone does have problem, I am also recording it so we can supply it afterwards if you need it.
Okay.
Okay.
Julie, just wanted to test my audio. Can you hear me, Jaime?
We can.
Okay.
Yep. So we'll let these guys start, and then I will call on you one at a time to unmute and ask your question and follow up, just like our remote press conferences. Thank you.
And everybody can hear me okay? Actually, Wendy, I can see you. Can you give me a thumbs up if you can hear me?
Yes.
All right, and thank you all for joining us this afternoon and for trying this new format for to engage with all of you. And actually, I will actually just want to start by saying I like this format a little bit because I get to see you again, and I haven't seen you during our press conferences recently. But we wanted to get together today. I'm joined by Jaime Saunders, the President and CEO of the United Way of Greater Rochester. And I'm sure many of you have heard over the last few days the recommendation from the CDC that people start wearing a cloth face covering in public settings where other social distancing measures are difficult. So places like going to the grocery store and pharmacies. Our Public Health Commissioner, Dr. Mendoza, is echoing this recommendation, and we're encouraging all Monroe County residents to start wearing a cloth face covering when they are out in public. And this is because we're seeing evidence that the virus can be spread when people aren't exhibiting symptoms yet. So covering your face anytime you're in public is just like coughing and sneezing into your elbow when you're sick. It keeps germs to yourself and helps to prevent you from unknowingly getting other people sick. But this should not make anyone think that you can start to do more in public and start to move away from social distancing. This is not an invitation to start to engage in risky behavior. First and foremost, social distancing remains the most important step that we can all take to slowing the spread of this virus. That means staying home. That means maintaining a 6-foot distance from anyone you're coming into contact with or even when you're going on walks around your neighborhood. And that also includes keeping a 6-foot distance and staying home as much as possible, even if you're wearing a cloth covering over your face and your mouth and your nose. You still need to keep that 6-foot distance. If you must go out and go into a setting where people are close together, like a grocery store, you should limit the frequency with which you go and the time that you spend there. And now we're adding, you should also be covering your face. So what is a cloth face covering? And what should you do, and who should be using it? First and foremost, a surgical mask and an N95 mask, which we hear a lot about on the news, still must be saved for our doctors, nurses, and our first responders. Those are critical supplies that are needed in healthcare settings. The rest of us are okay to use something that we can make ourselves at home. If you're a talented sewer or you use your own sewing machine, there are some patterns online, and we making those available on our website at monroecounty.gov. And we also have plenty of materials and instructions out on our social media, Facebook and Twitter accounts as well. But what you could also do if you do not know how to sew, as I don't, there's plenty of ways you can make them at home without having to sew. I am going to attempt to try to do this now live here during the press conference. I'm going to show you how you can make your own mask from home. All you really need is a piece of cloth that's about 22 inches by 22 inches. It could be more or less depending on how much area you're covering, how big your face is. And you need 2 rubber bands or 2 hair ties. So I'm going to lower my screen briefly here. So we're going to see if this will work live. But what I have here is a piece of cloth that's about 22 by 22. And the way you make this mask is you take the end of the cloth and you're going to fold it 3 times over. 1, 2, 3. You flip the cloth back over so that the flap is facing you. And then you take 1 rubber band You put it on one side. Take the other rubber band. You put it on the other side. And now you can see the mask forming here in the middle. Fold it over, one end over, and then find the middle. Take this end, fold it into the middle, a little tug, and you have your mask. I'm going to put this back up. You have the mask. Should fit. I don't want to talk while it's on because you won't hear me, but it should fit right over your mouth and face, like so. This is a quick and easy thing that you can do from home, as so long as you have cloth and you have a rubber band or something as simple as a hair tie. You need to make sure that your mask fits snugly and comfortably on the side of your face. It should be secured with ties or ear loops. It should include multiple layers of fabric, allow for breathing without restriction, and it can also be washed and dried without damage. When you also make your own, you should also wash them regularly, depending on how often you use them. So we are saying in sum and substance here today that in Monroe County, we are agreeing and encouraging that all residents in Monroe County follow the CDC guidelines to wear mouth and nose coverings while out in public, and it's something you can easily and quickly do at home, whether you know how to sew and you can use a sewing machine and make something a little more elaborate. But even if you don't, if I can put something like this together myself, anyone watching this video at home or can put this together themselves as well. But we do know, though, moving forward, that it's important that while most of us can do this and have access to those kind of supplies and materials at home, there are a lot of people across our community who are going to need help and will not have access readily available to these kind of materials within their homes. So that's why we're continuing our partnership with the United Way of Greater Rochester, and that's why we have Jaime Saunders, the president and CEO, joining us today, because there's so many other important tasks in our community, from food needs to checking in on our seniors. The United Way and its partners are stepping up to coordinate an effort to ensure that these cloth masks and face coverings are available to our community-based organizations, as well as people in need that those community-based organizations serve across our community. And this is an ongoing effort that we've had with the United Way, who really has stepped up in a way that is really remarkable over the last several weeks, to help coordinate all the various community-based organization activities and nonprofits in our community to make sure that people have what they need in order to get through the crisis that we're facing today. So I'm going to turn this over to Jaime, who could talk a little bit about how folks can reach out to the United Way to do a couple different things. I know they're looking for people who can help make masks and sew masks and donate them, and then also how you can obtain one. So Jaime, we'll hand it off to you.
Thank you, County Executive. Can you hear me? I can see Wendy and Julie. Do I have a thumbs up? Audio's coming in okay? Great.
Gotcha.
Thank you so much. It's incredible to think that we're entering the 4th week of this together. And I remain deeply inspired by the outpouring of support from our community to help in so many ways. It was Coretta Scott King who once said, "The greatness of a community is most accurately measured by the compassionate actions of its members." And with that as a measure, over the past few weeks, it is certainly clear our community is truly a great one. United Way is proud to partner with the county and with all of you to serve in this critical role of channeling our community's goodwill to help those throughout our region. When we asked for funding for the Community Crisis Fund to address the impact of COVID-19, the community responded. When we put out a call for healthy volunteers, an army of good, the community responded. And now, to help follow recommendations by the CDC and the Monroe County Public Health Department, we are asking for help coordinating donations of homemade masks with the Mask Makers Initiative. Already across our community, there are talented and giving people making cloth
Jaime, we're
masks.
having a little trouble with your audio.
Oh. Can you hear me yet? Testing 1, 2, 3. Good. To follow recommendations for the CDC and the Monroe County Public Health Department, we are asking for help coordinating donations of homemade masks with the Mask Makers Initiative. Already across our community, there are talented and giving people making cloth masks for themselves, for their neighbors, and donating to healthcare settings and nonprofits. Thank you. Thousands of homemade masks have been created and delivered to our hospital systems in the last few weeks alone, and the need continues to grow. Our human service agencies continue to provide essential services, from homeless shelters to residential facilities to emergency food distributions to meal deliveries to our older adults and more, where their staff and clients are in need of cloth coverings. Our initial request from our nonprofit partners is more than 50,000 cloth masks are needed this week alone. The need is significant. We know the intent is to use a cloth face covering to help slow the spread of COVID-19, and we need to be able to make them available to everyone who needs it. And we need the community to help make this happen as mask makers in Monroe. First, we ask that you make a mask for yourself and your family members, just as the county executive said. Then provide them to your neighbors and friends. And if you have the materials and are willing, you can make them for others in the community who need it. You can deliver your homemade masks to any Goodwill location. We're so grateful for our partnership with the Goodwill, and their staff will be able to receive these masks, which in turn will be distributed to nonprofit agencies who've requested them through United Way's central supply process for free. Our role, as always, is to help match those who want to help with those who need it most, and to ensure some agencies are not overwhelmed with donations while others have none. For more information on how to make masks, how to donate your masks, and more, please visit uwrochester.org. We also encourage you to visit United Way's Volunteer United site, where there is information on much needed in-person and virtual volunteer opportunities and a listing of in-kind supply and donation needs that you can ship directly to nonprofits right from your couch. Donations are still needed for United Way and the Rochester Area Community Foundation Crisis Response Fund, and more information can be found at uwrochester.org. And as a reminder, if you or someone you know is in need of help or support services, please contact our community's Central Information and Referral Hub resource at 211, 24 hours a day, 7 days a week, including online and text support. Thank you to everyone for your continued support for our community as it faces one of its greatest challenges ever. Take care of yourself and your neighbors, and we know we'll get through this. Thank you so much.
Thank you, Jaime, and thank you for your leadership and support at the United Way, and for all of your partners at the United Way for your help for this, the help you're providing this community to get us through this crisis. And I want to talk a little bit before we open it up to questions about where we are in terms of social distancing and why this remains so critical to how we weather the crisis that we are in today. I have seen a remarkable change in behavior over the last several weeks as we started to implement social distancing rules, and even from New York State, the definitions of what's an essential and non-essential service. The number one thing that we can do here in Monroe County to stop the spread of the virus and to save lives is to stay home. If you do not need to be out of your home to get food, go to a pharmacy or something of that nature, we need to stay in our homes. This is the number one thing that every doctor across this country is recommending we do to stop and slow the spread of the virus. And we can do that here in Monroe County. As we start to see the numbers increase, I do understand that folks are going to start to get tired. And this is anxiety producing, and there could be some fatigue that's going to start setting in at some point about staying home. I know it's difficult. I have two children myself. They are actually, today's my daughter's birthday. They are 9 and 10, and this is not easy to do. They're home all day. There's really not a lot of places to go except out for a walk. But the reason we're staying home is because it will keep us safe. It will keep our friends, our family, our relatives safe, and it will save lives. And so we're doing it for a purpose. We're staying home for a purpose. This community has been very good about this, but we are starting to see that some fatigue is setting in. There's a website that rates communities based on, I think, cell phone data about how far phones are moving. And so we can see how people are moving about the community. It's not something Monroe County tracks, but it's a website that there's data available on this. Monroe County was getting an A about a week and a half ago. We slipped down to a B, and I think this morning we were at a C. So we need to start tightening back up again, stay inside our homes, because as this curve is starting to go up and we start to see more and more cases coming forward in Monroe County, this is not the time to loosen up. This is the time to put our foot on the gas pedal, double down, and stay inside. I also want to make sure that as the weather is getting nicer, that we're being respectful when we're in public parks, on sidewalks, going for walks. We need to make sure we are staying 6 feet away from everyone around us. Right now, our Monroe County parks are open for individuals and families to go out and enjoy, so long as we continue to see a 6-foot distance and separation. We do not want to have to be in a place of closing down parks, particularly when the weather gets nice, but that's a step that we would have to take if we can't get the 6-foot separation between individuals there. I also would like to address what is essential and what is not, particularly when we're going to businesses that are essential. One of the most common reports that we keep hearing back here is the number of cars that are in the parking lot at Lowe's, Home Depot, and places like that. They do provide an essential function and service and need to remain open, but we need to think about why we're going to those stores and how many people from each household is going to those stores as well. If you are living in a family and in a house where you can go one person at a time to the store, that's how you should go. I can tell you from my own personal experience, with my wife and I, we have 2 kids. Only one of us will go to the store at a time, and we do not bring the kids with us. If you have a situation like that, you should do that. If you are in a position to go shopping for somebody else, particularly someone who's older or from a more vulnerable segment of the population, you should go grocery shopping for them. You should help your neighbors so they don't need to be exposed without need. And therefore, we start cutting down on the number of people that are going out. So we got to be thinking about being socially responsible when we go to the store and we do those essential needs, and that we only do them when it's essential. So again, thank you for getting the message out. I appreciate the public working with us and everyone in Monroe County to start covering our faces. I did make the mask. I can do it again if a reporter needs me to do this again here live on TV. But again, I'll make the point that if you have the materials at home to be able to do this, I know it can be a anxiety-producing announcement that we should all wear masks, and I'm aware of that. But one thing that I can reassure you is that if you do have the material at home, all you need is a piece of cloth and you need 2 rubber bands. If you have those materials, if I can do it, you can do it. You can make your own mask at home. They're washable. If you do not have the ability to make your own mask at home, the United Way is here to help, and we thank them for their work and their partnership. So with that, I think Jaime and I would be happy to take any questions that folks have for us.
Okay, first up we have Sabrina Majori from WROC TV. Sabrina, are you with us?
Yes, hi. Thank you for taking my question. So in terms of compliance, is there going to be an enforcement mechanism to this? Will people be getting ticketed if they're not wearing masks?
Right now, we're asking for the public's cooperation in wearing these masks. There's no executive order to require this at this point, but we're going to keep an eye on this and ask people to really participate and wear these masks while they're in public.
Great, thank you. And a follow-up to that, yes. So obviously there's been high demands for masks. We've spoken to some medical suppliers and distributors who said they've had a hard time getting their hands on masks. So is the primary suggestion to avoid going through a medical supplier and actually make your own mask?
Yeah, so we are asking, yes, to answer your question, we are asking people, individuals at home to avoid going to medical supply stores. We are in need of surgical, procedural, and N95 masks for the healthcare systems. What we're asking the public to do is use these cloth masks that they can make at home, because remember, it's not wearing a mask out in public and doing a universal masking policy is not an invitation to do something that you wouldn't normally do. The risk level is higher in a hospital where you're trying to protect yourself and the public. One of the main reasons to wear a mask right now in the public is because we know now that the virus can spread when someone is asymptomatic. And so really being able to cover your mouth like this prevents you from making someone else sick.
Great, thank you.
You're welcome.
Tanner Jubinville is up next. He's from 13 WAM, and following him will be Jeremy Newell from City Newspaper. Tanner?
Hi, Adam.
Hi, Tanner.
I heard the governor say at his press meeting earlier that he wants to see more local governments enforcing social distancing rules and things of nature. Is there anything being done right now, or are you kind of just relying on the public to kind of adhere to the guidelines?
Yeah, so we have a couple different efforts right now. First and foremost, in terms of enforcement of essential businesses, what is essential and what is not, the Attorney General has an enforcement mechanism, and we have that complaint hotline and way to make those complaints available on our website. In terms of social distancing, particularly at the parks, we have worked with the Sheriff's Department on a two-phase approach. Right now we're in phase one, which is an education phase, which is to, if you see large groups gathering in parks and outdoor setting, is to engage law enforcement who will provide education and try to disperse individuals away. If that does not work, we will be enforcing this, like I said, through park closures and other measures. We're asking the public to work with us, though, because I do understand that this is difficult, but we do need compliance. We also, the third approach that we have is we do have a task force that is working on a code inspection compliance that would allow us to put a little more teeth into these should it become necessary.
You envision that could become necessary within the next couple of weeks? I know there's, as the weather is, you mentioned it gets nicer, people are having that urge to get outside. I mean, do you envision having to get people and things like that coming up?
I hope it doesn't come to that, but we are putting the plans in place for that to make that enforcement available. And I've seen it just this last weekend. Yesterday, I was out. I think we walked the dog twice yesterday. There's more people walking around my neighborhood now than even typically would be on a nice spring or summer day because everyone's inside their home, being safe in their home. But I think as long as we keep that 6 foot away, if not more, and be respectful, then we can continue like that. Otherwise, we're going to have to enforce that and keep everyone in their homes. That's the last thing that's not something we would want to do. But we do have to stop the spread of this disease. And we do need cooperation from people to take this seriously and understand this is a very serious situation. We are losing lives in our community. And while this has been going on for a few weeks, it's going to continue to go on for a few weeks more. We need cooperation from the public. We also need you to start wearing your face covering. Thank you.
Jeremy Newell from City Newspaper is next, followed by Patty Singer from Minority Reporter.
Hi, Adam and Jamie. I'm wondering if either one of you may be able to speak to this. I've heard some skepticism from folks about the effectiveness of the cloth face coverings. People saying the virus can get through them and all that. And I know that's not really the point. Can you just talk a little bit about why these are valuable?
Sure. These are valuable in the same way that when we ask you when you're sick, whether it's with the coronavirus and you have COVID-19 or whether or not you have a cold or the flu, when you're asked to cough or sneeze into your arm, into your sleeve, it's effectively the same thing. When you put this over your mouth and your face, you're coughing and sneezing into that. So it slows the spread and provides that layer of protection that you didn't otherwise have. But that's also why it's important to note that this is not an invitation to start engaging in risky behavior or to lessen our social distancing rules. This is really just to add an additional layer of protection, and also to remember this is not something that's going to add a fail-safe protection from you contracting the virus. This is to help cut down on the chances that you yourself can infect the people around you.
Great, thank you.
You're welcome.
Patty Singer, and then Steve Orr from the Democrat and Chronicle will follow Patty.
Jamie, you broke up on me on the feed when you were talking about how is this going to affect low-income communities, the help for them.
Great. Can you hear me now? Is my audio okay?
broke up, and I don't know if it broke up for other people or not, but it broke up on me. So
Yeah.
how's it going to help? What are we doing to help our low-income folks?
Great question. Patty, can you hear me now? Can you confirm?
Yeah. Yes.
Okay, great. Yeah, this is exactly the effort. So we're asking for Monroe mask makers. So I know if you go on Facebook and other groups, there are already amazing sewing circles and businesses who have already stepped up to make masks for those who don't have access to them. And that's exactly the key point here. So we are looking at minimum to have 50,000 masks as soon as we possibly can to support our human service agencies who are absolutely supporting both their staff and their clients, who of course are serving the low-income populations that you speak of. In addition, we want to, if we have enough masks secured, we would make those available at the emergency food distributions that FoodLink oversees throughout our region, that we would make that part of the package of distribution so we can reach those who have are in need and have those supports. That is the intent very much of what the Mask Makers is about.
Thank you. As a follow-up to that, to both of you, how is the threat of potentially closing parks if we don't stay away from each other and not wear a mask, and some of the other kind of punitive things I'm hearing, not scare more people than be reassuring?
Well, I don't want to look at them as punitive. What we're looking at is at keeping people safe. The reassurance I can give individuals here is that we know through science and through our healthcare professionals that keeping a distance from each other and staying home is the fail-safe way of stopping and slowing the spread of this virus. And so this isn't meant to scare people. It's meant to give them facts and information. And the information is that we have to engage in social distancing, keep a safe distance from our friends and neighbors, and we need to stay at home as much as possible. So I hope this is a reassuring message that there is a way to stop and slow the spread of the virus. The way to do that is to stay safe by staying home. The other thing I just wanted to add before I moved on was, I talked about coughing and sneezing into your arm. I say this, the masks are also beneficial just in terms of normal respirating and breathing, because the virus we know can be carried in the particles that come out when you speak or when you cough or you sneeze. And so a cloth mask will cut down on that getting out into the environment.
Thank you.
You're welcome.
Thank you, Patty. Steve Orr from the Democrat and Chronicle is next, followed by Alex Creighton from WXXI News.
Hi, Adam, a question for you. I should say you and Jaime have done a fine job explaining the mask situation. I just wanted to ask an off-topic question real quick if I could. We have reports that 4 people died on a single floor in a single nursing home in Rochester yesterday. Can you tell us anything about that?
I don't have any additional information about that, Steve. But with the nursing homes, I know they're overseen by the New York State Department of Health, but I don't have any additional information about what you'd be referencing. No.
All right. Thanks, Adam.
You're welcome.
Alex Creighton from WXXI, followed by Jennifer Lukey from WHEC.
Okay.
Alex?
I hope this is working. Can you hear me?
I can hear you, Alex. Yep.
Okay, very good. All my rubber bands are at the office, by the way. I don't know, why wouldn't a policy like this be implemented much earlier when it was, pretty obvious that this pandemic was going to be so impactful?
Mm-hmm. Well, I think information changes that the public health officials know about this virus. Obviously, it's new this year. And so as that information changes, we grow and adapt to that. This was just a recommendation that the CDC has put out over the weekend. And we think that this is prudent to follow here in Monroe County, and particularly because when you're in a position of having community spread and you couple that with, which we have in Monroe County, and then you couple that with the new knowledge that's being gained that this can be spread when someone is asymptomatic, and I think that's something that they're seeing now across the country in a lot of different places, that this would be a prudent measure because you and I might feel fine today, but we don't necessarily know that we have it. We have to assume, and I think it's fair to say, and I know that Dr. Mendoza has said that, we need to move about assuming we have it, or that you're coming into contact people that have it, or you're going to places where someone has been that has had it. So you have to take those proper precautions now wherever you go. So I will start wearing one of these masks when I'm out. I wore one yesterday when I was out, again, grocery shopping for my family by myself. I will wear this because I don't know for sure whether I'm sick or not. I have not been tested and I feel fine, but I don't know. And just like when I go again through the store, I wash my hands at all the stations that I wash down my cart, and I don't get near anybody else because I don't want to contract the virus from anybody else within the store. So I think now that there's a lot more information, you're getting a lot more recommendations out from the CDC about what we should do, and I would strongly encourage us to follow them.
Great, thank you.
You're welcome.
Okay, Jennifer Lukey from WHAC, and then we'll hear from Wendy Wright of Spectrum News.
Hi, Adam. A quick question for you. On Friday, the governor said he was going to sign an executive order allowing the National Guard to come upstate and take ventilators and PPE if necessary from hospital systems that had some to spare. I know you put out a statement about that, but I'm wondering over the weekend if you had any contact with the governor's office, if they are looking at any Rochester area health systems to take any of those supplies from.
So I have had conversations with the governor's office to relay what I said in my statement and where I think we are here in Monroe County. And, I'll put you back to what I said before, but I'll expand about it just slightly, is that I do think it's reasonable as the curves of this rise and fall at different rates across the country and across the state, that communities that have additional resources help other communities. You're going to have to move resources around, and that's people and also equipment. And you're already starting to see that. New York State received 1,000 ventilators from China, I believe, over the weekend I saw that. And then from Oregon, another couple hundred ventilators came in. Monroe County is not in that position right now. We are still reaching towards the top of the curve. We are still going up. And through our efforts with the hospital systems to understand the day-to-day needs of our PPE, but also the needs that we think the number of ventilators we will need in the next couple of weeks, we're not a donor community yet when it comes to that. It's hopefully someday we might be when we're coming down that curve and we're seeing other places ramp up. But today we're going to need the ventilators that we have, because in 2 or 3 weeks, as we start to see the curve still going up and our need going up, we're just not in a position to be giving up ventilators.
Are we in a position where we are going to need more ventilators?
Actually, yeah. At the press conference about a week and a half ago, the hospital systems acknowledged that they're trying to bring in additional ventilators here. So, yes, they have said that. And I also talk about PPE for a moment. I say it's personal protective equipment, masks, different types of masks, gloves, gowns, face shields, things like that. We have been working very diligently with New York State. I speak to them several times a day, actually twice already this morning before lunchtime here, about our supply needs, particularly with the hospital systems and other healthcare providers. And they have been they've been responding by sending equipment, because essentially we don't have a stockpile, we have a supply. Monroe County has a supply and New York State has a supply. And the role that we play with our emergency operations system is that when a healthcare system starts to get low on any of those items of PPE, we can then help supply that to them to keep them going and manage that, even though they're using their own private supply chains. We have supply chains that we're engaging with right now to try to get more here, but New York State has been responding by sending PPE to us.
Thank you.
You're welcome.
Okay, final question from Wendy Wright at Spectrum.
Hi, good to see you all. I think I want to follow up on the ventilator question a little bit more. So when you say we're not in the position right now in Monroe County to be able to send ventilators elsewhere, does that mean none are going to be leaving, because the governor wanted 20% from everybody?
Well, it's 2 things I can clarify. One is that we do have ventilators in the sense that it's keeping up with the need here in Monroe County. So if an individual goes into the hospital system today requiring a ventilator, that one will be there. But the governor has also asked that the systems volunteer excess capacity, and has clarified that even over the weekend. I saw at a press conference and a media statement that they also are asking the local hospital systems to take into account what their future needs will be over the next couple of weeks. And those are the calculations that our hospital systems are doing now to understand the number of ventilators they have, where we think we'll be on the apex or curve in a couple of weeks, 3 weeks from now, and then that's how they're balancing it. And so they've said we're going to need additional ventilators here, and I think that's why they're not in a position right now that some other communities might be in. But I would also point out, I have not seen an executive order yet, but I understand they're asking hospital systems to volunteer excess capacity.
So it's not like National Guard is coming in and taking ventilators from our area?
I have had no indication that that's going to happen.
There's been a lot of discussion about this coming week being one of the worst yet, and that's why there's some encouragement to really buckle down and avoid the grocery stores and the pharmacies. And that's been essentially the only thing people who are following the guidelines have been doing, is going to the grocery stores. That might be something that's a little nerve-wracking or even scary to some people.
Well, yeah, I can respond to what you're saying. Yes, the U.S. Surgeon General did say this is going to be a very scary week in the United States over the next couple of weeks. And it is. We're losing an awful lot of people across the country. We're losing too many people here at home in Monroe County and in metro regions and rural areas, suburban areas across the country are losing far too many people to this. But I would like to point this up to the reason we talk about social distancing and the reason why we keep talking about the curve and how we can flatten the curve is because if you can flatten the curve, which really means to slow the growth of the spread and slow the rate at which it's growing, if you can flatten that down, you might still, at the end of the day, get a similar number of people sick, but you can keep it in a way where the hospital systems and healthcare professionals can keep up with the demand from the patients that are coming in and can have, and my hope would be you could have a better outcome. And you can keep the supply chains running and everything like that. It also means it might take even longer to come out of this because you slow it down. It might still even take a while to come out, but at least it becomes manageable. One of the things I'd like to point out when we start talking about the curve as well, and we're still working on our numbers here. If you notice the day-to-day reports, and I'm very proud of our public health department and our communications team of how transparent they are in putting information out every single day about new cases, hospitalizations, things of that nature. You can see I'm not quite still seeing that exponential growth yet, but you're still seeing a growth. So you're still seeing it go up. And what that suggests to me, at least, is that if the curve is still a good 3 weeks away, 4 weeks away, we're looking at the beginning of May, second week of May, if that's when the apex and the peak comes, there are a lot of people who are going to need hospitalizations, going to need ventilators, are going to need that hospital stay in the first or second week of May who haven't even caught the virus yet. They're not even sick, which means it's not too late. It's not too late to slow down the spread of the virus and prevent that peak and that apex from coming. But the only way we're going to do that is if we all work together, help each other to stay socially distant and to stay in our homes as much as possible, to really think about when we go out to the store, do we really need to go out to the store? Does everybody that I'm putting in my car to go to the store with me really need to go to the store with me? And I'll tell you, yeah, sometimes the answer is yes. You can't go to the store by yourself. If you're home alone with a child and you have to go to the store and it's an emergency, you put your mask on. But we really need the community's participation in this, because if you really think about those worst case scenarios and you really think about what the U.S. Surgeon General is saying about when these apex are coming, if your apex isn't until late April, early May, a lot of those people aren't even sick yet, which means it's not too late to stop them and prevent them from becoming sick and prevent the worst case scenario. Okay, so thank you. Thank you, everybody. Thank you very much, everyone, for covering this today. Thank you again for all of your entertainment and delight. I'll be putting a copy of how to make a mask for myself online, so you can see that today and follow that. And we appreciate everyone's cooperation. It was nice to see you all today. Thank you.